So what we want to do today then is talk about the nervous system. And the nervous system is certainly an interesting topic. This will be our only discussion of it, of course, in the class today. And we're going to focus in on this picture of a skull with a bar going through it and talk about what happened there and what we learned as a result of that. So the nervous system is divided into a central nervous system, which consists of your brain and your spinal cord, and a peripheral nervous system, which consists of all the other nerves in your body that connect the brain and the spinal cord to everything else. And so there are differences in the peripheral and central nervous system. It's interesting and it's unfortunate that the peripheral nervous system has some ability to heal itself. If you cut a peripheral nerve, that nerve can regenerate to a certain extent. The nerves of the central nervous system, the brain and the spinal cord, don't have any ability to repair themselves. And so damage to those portions of your nervous system are permanent. If we look at the brain itself, we see that the brain consists of several different portions. The outer portion of the brain is referred to as the cerebrum. The sort of almost worm-like perhaps appearance that we see all over the brain there is composed. That is the cerebrum. So this would be, of course, a person that's facing towards the door there, as I am. And so we're looking at just one side of the brain. The cerebrum, interestingly, is the part of the brain that's responsible for what we refer to as higher orders of thinking. And so there are other parts of your brain that, for instance, are responsible for keeping your heart beating, and that are responsible for causing you to be thirsty, causing you to have all these functions and causing your body to work just like animals do. But you've noticed that animals don't do a lot of math, and animals don't do a lot of planning and consideration of the future and so forth. And so much of, but not all, much of this occurs out in the cerebrum. And so we refer to these things as higher orders of thinking. So the cerebrum is divided into different sections. We have a frontal lobe to the cerebrum that is shown in this particular area. I'm going to do a little bit of pointing with the cursor today. The parietal lobe, which would be the area that we see that I'm basically outlining right here. The temporal lobe, which is the lower portion of the side of the brain here. And the occipital lobe that we see on the back portion of the brain. The insula is an internal portion of the cerebrum that we can't see from this particular angle. So the cerebrum is certainly an interesting portion of your brain. And it's interesting that to a large extent we have mapped out this cerebrum. It should also be pointed out that there's a lot about the brain that we just don't understand. The brain consists of trillions of neurons. And so I'm not implying that we have this deep understanding of what every portion of the brain does, but we do have a general idea in many cases of what different areas of the brain do. And so that's illustrated on our screen there. And so interestingly, if we look at the brain from a top view, if we look down on the front of the brain, then we see this particular region of the cerebrum that we refer to as the primary motor cortex. It's just been dyed blue there in this diagram to show us what part of the brain we're talking about. Now if we come down here to, lost the cursor, to this part of the diagram, then we see that here we've sliced through the brain. So we've taken a section through the brain that we would refer to as a transverse section, and we're looking at it in cross section. And so interestingly, what we see is that for instance, this part approximately of this primary motor cortex then causes your arm to move. And this part of the primary motor cortex moving to the outside is associated with the nerves that go to your elbow. And as you go out, you have all these different portions of the cortex that correspond to certain parts of your brain, so certain parts of your body. So here's the neck, eyelids, face, lips, tongue, and so forth. And you can demonstrate this, and this sounds disturbing, but it's harmless to the individual. You can demonstrate this by taking someone who's undergoing brain surgery and has the entire portion of their cerebrum exposed, and applying a little bit of electricity to those particular parts of the brain, which is how this information has been gained for the most part. And if you shock, just ever so slightly, say this portion of the brain, then the tongue moves. And if you shock this portion, then the eyelids move. You shock this portion, then the elbow moves, and so forth. And so, fascinatingly, that is how you're wired up to a large extent. And so you realize, perhaps, and we'll go ahead and state it now, that your nervous system consists of a series of electrical signals that go from one place to another. And really, that's how your body operates, these very low-level electrical signals that start in the brain and go out to various parts of your body. And then also that start in various parts of your body and go back to your brain. And so that's why you can move, that's why you can feel things, that's why you experience pain, that's even why you experience emotions. All of those things go directly back to the brain and the electrical signals that are transferred there. Eric.
So when you say that, like, you cut part of your nervous system and you can't,
it doesn't heal?
Yeah, it doesn't heal.
Mm-hmm.
Shouldn't they be able to, if we were to be able to, like, master and understand what electrical, like signals
Mm-hmm.
that were sent to move your hands and stuff,
Uh-huh.
would they be able to, like, meet it right here or wherever it's broken, send it to your body and let you move, at your command?
So, like, make a little bypass, an
Yeah.
artificial bypass?
Yeah.
Yeah, hypothetically, yes.
We haven't figured out
We haven't figured out how to do that. So we could, it's a great point. We could do that. And you understand that this is one of the most, probably as much money is devoted to this topic as to any other research topic. And so that's a good illustration of how small and complex this is. We just can't do it. We can't. If you could somehow, look at the millions of little neurons that were there, and we could tease out what was what, then we could do exactly that.
And also, when you also say, like, this is, like, been cut, it's not fully cut, is it?
Well, not always. Sometimes. When we're talking about spinal cord injuries, it may be crushed, it may be, severed completely.
Okay. And that
So-
wouldn't stop their heart or something like that?
No, this is an interesting question, but we talked briefly about on Wednesday the heart and how the heart is continues to beat even in the complete absence of the nervous system. It's what we call autorhythmic. So you can take the heart out of the body. It's got its own little nervous system, so it generates these signals that cause it to beat. It's an interesting point, Eric. So you might not have the speeding up and slowing down of the heart, but it would still continue to beat. So it's a good question. All right, and perhaps even more interesting is this. So you realize that different parts of the brain cause different parts of your body to move. Well, different parts of the brain are also responsible for sensations in different parts of your body. So what we're saying then is this, that when you touch this table, when I touch this table with my finger, an electrical signal runs up my brain, goes to a particular part of my brain, and stimulates a part of my brain that tells me that I am touching this table with my finger. And so you can reproduce the exact same thing by going to the brain and directly stimulating the part of the brain where that electrical signal arrives. Does that make sense? So the brain is mapped out into these different sections. So once again, we look at all these different sections. The map looks a lot like the one that we just looked at, but in this case, it's responsible for sensations. And so someone with their skull opened up and their cerebrum exposed, if you stimulate this particular part of their brain, then they feel a sensation on a particular part of their face. Here, a part of their teeth. Here, the tongue. Up here, the forearm. And so interestingly, the reality that you experience, the sensations you experience, the pain that you experience, is all a result of these electrical signals going back to the brain and telling your brain that you're touching something with your finger here, or you're experiencing pain in some part of your body. And so it's a fascinating topic, I think, but it's something that's incompletely understood, but we do have some knowledge concerning it. And you can illustrate this pretty powerfully by simply the concept of anesthesia, right? At least the idea that all of this goes back to electrical signals. And so you realize that when you go to the dentist and you get say a root canal, or you just get a cavity drilled, it may hurt, but it's not something they have to tie you down and knock you out for, right? Which is what they used to have to do. And so they shoot some Novocaine into your gum there, and that all that does is, for a temporary period of time, stop those electrical signals from going to the tooth back to the brain. And then it wears off and the signals start again. And so that's the idea behind anesthesia, which is a great, I think we'd all agree, advancement in medicine. We didn't have that 150 years ago. And so surgery was this horrific prospect. I think, as I talked about perhaps at the beginning of class, doctor would say, look, you've got to have surgery or you're definitely going to die. And people would think about it and say, I think I'd just rather die rather than be cut apart with no anesthesia. it's certainly something that's benefited us greatly in our, as we've gained an understanding of it. All right, other questions or comments there? Okay, so what we want to do is spend a moment talking about a different part of your brain, the hypothalamus and pituitary gland, which are interesting portions of your brain. To look at these parts of the brain, we have to go down in the very middle of the brain. So if we look at this little blue section and then look over here to this inset, we're looking at the very center of your brain. If you sliced it right down the middle from front to back, this is what you'd be looking at. So I want to draw your attention to two particular portions. There's a number of parts labeled here. But here we have a region of the brain referred to as the hypothalamus. And just below it, on this little stalk that we see right here, is your pituitary gland. It's only about the size of a pea, as in the vegetable. But the pituitary gland has a tremendous input into a lot of different things that happen in your body. The pituitary gland will determine if you, for instance, grow to be, say, 4 feet tall, or if you grow to be as tall as the tallest guy in the world. And how tall was Robert Wadlow, which is the tallest guy that we've ever on record that has existed on the face of the earth. So this is his dad that we see here on the left. And how tall do you think his dad was? His dad was about, I think his dad was 5'10" or 11. He was almost 6 foot, 6 feet tall. And so Robert Wadlow was 8'11", and he's the biggest guy that that's on record that's ever lived. He died at a very young age. Not necessarily as a result of his height. He got a bacterial infection and died at age like 22 or so. But he was a big guy, obviously. And so interestingly, he got that big because of a pituitary gland disorder. Your pituitary gland produces growth hormone, a hormone that you have heard of, no doubt. And a lack of growth hormone will cause you to grow to be less than 4 feet in height, and an excess of growth hormone will cause you to be, say, 7 feet tall and be a great basketball player perhaps, or even 8 foot, almost 9 feet tall. So the pituitary gland does other things as well. It controls when you go through puberty. It controls much about your metabolism. It does all sorts of things in your body. And interestingly, just the size of a pea situated down there in the very center of your brain. All right, let's move on a little bit then and talk about the story of Phineas Gage. Phineas Gage is an interesting story. He was kind of an unfortunate individual, but he lived in the 1800s in this country, and he was a railroad employee. And so one day Phineas Gage was working on the railroad, and specifically they were blasting, as I'm sure was a large percentage of what they did. And so they drilled holes, they still do this, they drill holes down into solid rock, pack it with dynamite, and then blow it up. So they drilled the hole, and they packed the hole with dynamite, and he was using an iron bar to tamp down the dynamite. And what he was supposed to do was put sand on top of the dynamite, so this wouldn't happen. But as you know, when you strike a rock with iron, then it produces a spark. And so he had forgotten to put the sand in and was tamping the dynamite down directly. A spark was produced, the dynamite exploded, and so it basically acted like a cannon. It shot this steel bar that we see depicted in these little cartoon diagrams here. He was bending over looking at the hole, and so it shot this steel bar into his head. And it entered his head just about right here in the bottom of his orbit there, and it exited his head up here. And it was just a clean shot, in and out. It went right through. And so the amazing thing is this. I mean, all that's not too surprising, but the amazing thing is that he fell on the ground and convulsed for a few minutes, and then he was still alive. And so they took him to the doctor. As you know, the doctors, of course, at that time knew nothing about the brain or brain surgery or anything like that. But they made him as comfortable as they could, and he lived and was fine. But the interesting thing about the story is this, that and all this healed up. He looked fairly normal. So it seems incredible, but those bones flexed a little bit. I'm sure that they didn't heal exactly right because there was nothing they could do to put him back into place, but he looked fairly normal. But the interesting thing is this, his personality was different after this episode. And so before the episode, he was a model employee, he had lots of friends, he had a pretty normal life, normal social life and so forth. After this event, he became a very poor employee. He couldn't show up to work on time. He became very irritable. He didn't have many friends at all because of this. And his personality was just different, night and day different after this event than before the event. And so he became, he couldn't hold down a job. His final job was with the Barnum and Bailey Circus as part of their freak show, which is something they don't do too much anymore. But at that time they would have these freak shows where they'd have the bearded woman and all these different things that people could come by and look at. And he was part of that, and he died at a relatively early age, and they're not quite sure why he died, whether it was related to this or whether it wasn't. But this gave us an idea and some insight into how the brain works. And so at this point, people said, his brain was modified as a result of this steel rod going through, and that did something to his personality. Maybe we can modify the brain and change people's personalities. And so that led to this great idea of the lobotomy. And so the lobotomy was a procedure that was used to modify people's personalities, people that were in which that was deemed necessary.
Did they pull out the bar, or did they just let them?
No, that's no. It went through. It went right out the other side.
Oh, it can.
Yeah, it went in and it went right out.
I thought it was like.
No, I mean imagine it coming out of a cannon. It's so powerful that tissue wouldn't have been nearly enough to stop it. Okay, so
It's like he had a airline, yes, I'm still getting
all right. So the lobotomy was an interesting and tragic idea in the history of medicine. And so people looked at different people in society and said, some people could use a personality change. We don't, their personality is bad for themselves and bad for society. And they figured out that they could modify the frontal lobe of the cerebral cortex, and that would change people's personalities. That's exactly where that steel bar went through in Phineas Gage. And so, what they did was they figured out that they did different things. At first, they took a needle, and this sounds horrible, and it is horrible, and injected formaldehyde into the frontal lobe, which just killed the frontal lobe. The frontal lobe has a lot to do with your personality, but it does not have a lot to do with your physiological function. So you can live without it, but you're not the same without it. They then, at first, resorted to ice picks, which they could take in and slide just under the eye without destroying the eye, and move them back and forth really quick, and it would just randomly destroy that frontal lobe. And then they got a little bit better and devised these knives that would go in through the eyes there, and they could twist them back and forth and destroy the frontal lobe. It sounds horrible, and it is horrible. It wasn't specific at all. It's just this random sort of barbaric practice. I mean, this was in the early, say, 1910, 1920 or so. And so who was this done on? Well, at first it was done on mental patients. So people that were in mental asylums. And they didn't understand at that time anything about the problems that those people had, but they knew that they were unmanageable. And they were just, perhaps that they yelled all the time or just wouldn't hold still or all sorts of different things. And after the lobotomy, what were these people like? Really calm. And it varied widely on the effects of this because it was just a very unspecific procedure. The effects varied widely. But for the most part, it calmed people down. And so it was practiced on more and more people. And in fact, even it was done involuntarily to a certain extent on people that were incarcerated. And perhaps most of the people that were incarcerated that had mental issues to begin with. But it was done in prisons. The guy that originally promoted this was very good at it. He could do a number of these in a day, which is pretty bad. But it was done. And so it's also interesting to note that, does anyone know, I'd be highly impressed if you knew the most famous person to ever have a lobotomy, at least in our country. It was the last name started with a K. It was John F. Kennedy's oldest daughter. No, that's not what I meant. Oldest sister. John F. Kennedy's oldest sister. And she didn't necessarily have mental problems, but she had a very low IQ, and she was given to fits, emotional sorts of fits that would disrupt the family, at least according to her father. The father was pretty, if you've read anything about the Kennedys, was kept a pretty tight control. You might, depending on your perspective, say unhealthy control on the family. And so he decided that his daughter in her early 20s would get a lobotomy. As a result of that lobotomy, she became just completely non-functional for the rest of her life. And so she was cared for by the rest of her life by her younger sister, which actually I forget her name. Was it Rosalind Kennedy? But Rosalind Kennedy was responsible for founding the Special Olympics, and she founded the Special Olympics as a result of her exposure to mentally handicapped people through her older sister. She cared for her older sister her entire life. And so the lobotomy was widely practiced. I had my grandmother who is still living. She's 99 years old, but her older brother, actually had a lobotomy. Was in a mental institution and had a lobotomy. And so in the 1970s, we started to realize that this is a horrific practice. This is in many cases making these people completely non-functional. In the best case scenario, it's altering their capacity to think and express emotions entirely. And so it was abandoned, and only in very, very rare cases, in a very specific manner, is it ever conducted today. But it's an interesting and very scary chapter in American medical history. Well, actually European as well. It actually originated in Europe, but was widely practiced in this country. And it's also interesting because it illustrates that to a large extent the personality of an individual is a result of the brain itself. And so changing the brain does alter the personality of an individual. Brittany.
Was it like automatic? Like their personality just like changed within like a second?
Just like that, yeah. Just like that.
My friend had like multiple concussions in soccer, and her mom said she started noticing changes in her personality. Is that possible?
I hope not. I hope not. I think it's unlikely. A concussion should... I'm not, as you've noticed, a neurosurgeon, but a concussion should cause bruising and then healing.
It was multiple concussions, like she got one more concussion, she would be able to do any physical activity.
Really?
The rest of her life.
I don't know. I hope not. I really don't know the answer to that question, but it shouldn't be anything like what we're talking about here when you intentionally and permanently modify a tissue of the brain. I guess it's possible, Eric.
You said they went in there and just like mangled that whole frontal.
That's right. Yeah.
Would they ever just decently alter it, not completely just destroy it? Like, would they ever I don't even know if that's even possible. Really, just like somewhat alter it and see what that would do or whatever.
I don't know the answer to that, Eric. I think the original goal was to completely sever that frontal lobe from the rest of the brain, and they did that at first by killing it, and then they just didn't have a good way at that time to. I'm sure that we'd be better at it now to go in and do it very specifically. And plus, it should be noted they didn't have any way to image it. Like they didn't have CAT scans at that time, so they didn't know what they were doing. So these different effects they got, they could just say, well, we turned our hands like this, and this is what we got. But they really didn't know what was happening inside the brain there. It's a good question. Other questions or comments here?
I'm pretty sure that each side of the frontal lobe, they do different things.
Mm-hmm.
So, I'm not sure if they've done experiments or something, but the one side only does speech or language or something, and then other sides.
Yeah, that's certainly true of your cerebral hemispheres. I'm uncertain, to be honest. You're probably right. I'm uncertain whether that's true of the frontal lobe itself, but you're absolutely right. The two halves of your brain are responsible for different things. But do you think it is the frontal lobe?
Yeah.
Or no, it's frontal lobe?
I think so.
Okay. Yeah, I'd say that you're correct. I'm uncertain about that. All right, so let's move on a little bit and talk about the spinal cord. So the spinal cord is interesting, and the spinal cord, remember, it is entirely the connection between the brain and the rest of your body. Now, there are 12 cranial nerves that come right out of the brain and they go to different parts of your body. And so those nerves go to your eyes, allowing you to see. Those nerves go, actually, interestingly, one nerve does go to the heart. And some go to the digestive glands, but for the most part, and especially to all your muscles, all the nerves or all the input from your brain gets to your body via the spinal cord. If we look at the spinal cord, then we see that we have 31 spinal nerves that radiate off of the spinal cord. So beginning just below your skull here, this is C1, the cervical, or the vertebrae in the neck region are referred to as cervical vertebrae. And so C1 is the very first cervical vertebrae, and C1 is also the term given to the first pair of spinal nerves that come off. Here's one spinal nerve coming off, and here's another. Here's C2, and so forth. We move into the thoracic region here, the lumbar region here, and the sacral region down here. And so these nerves radiate out to the various parts of your body and connect to both your internal organs and to your muscles and to your skin as well. And so interestingly, we can take the human body and divide the human body up into these regions that we refer to as dermatomes. Dermatomes are regions of the human body that are innervated by a particular spinal nerve. And so what we're saying then is that if someone pokes you right here on the shoulder, then that nerve is getting back to your spinal cord via spinal nerve C5. And if someone pokes you at a various place on the body, it's getting back to your brain via a different spinal nerve. So to some extent, you can tell if you have damage to the spinal nerves, you can tell which nerves are damaged by simply probing someone gently in different parts of their body and telling whether or not they can experience that sensation. So that's our spinal cord. All right. And so we want to talk, as we finish up here, about reflexes. And so reflexes are a portion of our nervous system that are completely involuntary. Reflexes are there, apparently, to help us avoid injury to our body. And so we'll talk about how reflexes work then and see how they would help us to avoid injury. And so if we look at our slide there, we see that all reflexes are fairly similar, and there are a number of different reflexes. We're certainly not going to talk about all of them. But they all require some stimulus to initiate that response, and then a rapid response takes place almost immediately. And then that same response occurs every single time. So the key is that in the case of a reflex, nothing's going to your brain. All of the processing is happening down in your body, just in the body itself. So let's take a look at what a reflex looks like. Here is one particular reflex. So what happens then is, let's say that this is perhaps not illustrated as well as it could be, but let's say that someone takes a nail and, well, let's say you're putting your hand down and you put your hand down on a nail and that nail pokes into your skin. And so that's what's being shown right here at number 1 on our reflex arc. And so an electrical signal goes back this nerve to the spinal cord. And here's the key. Here's the difference. Most of the time, like if you touch this table, then that impulse goes back to the brain, and you decide what you want to do next. Do you want to push harder on the table, or do you want to pull your hand away? In the case of a reflex, everything happens within a fraction of a second. So the nerve impulse goes back to the spinal cord, and the electrical signal goes just like this. If you follow the cursor there, it jumps from this blue nerve carrying the signal in through this purple nerve that takes it through the spinal cord itself, and then it goes back out this nerve that we call an effector, which goes back out to your arm. And so in this case, it's going to a muscle that will pull your hand away from the source of pain. In this case, it's your bicep. So if you touch a nail on the table here, then if your bicep contracts, it pulls your hand away from whatever it is that's causing that pain. And so interestingly, all reflexes work like that. And there's a bunch of different reflexes in the body. But the key is that the processing takes place in the spinal cord. It never makes its way back to the brain, so it's completely involuntary. So when you sit on the table at the doctor and he taps your patellar tendon there just below your knee, that tricks your leg into thinking that your leg is being stretched way back like this. And it's going to stretch this muscle so much, your quadricep, that it hurts it. And so what does your leg do? It kicks forward, right? So you tap that patellar tendon and it kicks forward just like that because of a reflex arc. It's not this one, of course. This is your arm, but it's one that looks just like the one we see on the screen there. And so those are reflexes. Questions or comments there?